Distinguished Senator Ehanire.
I represent Benue Northeast Senatorial District. Mr. Nominee, Dr. Osagie Ehanire, I have read your CV, which is a highly impressive professional CV in the medical field. Your areas of study, your places of study, your qualifications, and the experience that you have gathered over the years clearly indicates that you are indeed a guru in medical sciences and medical practice. The worry we have in this nation today is that our medical services are very poor, as has been typified in the growing proportion of medical tourism, which Nigerians are making today at such high proportions that it begins to worry us. Before now, Nigerians used to go to Europe, and particularly Germany, which is one of the highly qualified nations in medical practice where you trained. They also used to go to UK and United States of America. Now it's medical tourism to India and Egypt. What, in your own opinion, do you think you will cause Nigeria to imbibe a drastic change in this attitude, especially if you get to serve this nation as a minister in the Ministry of Health? The issue of health insurance is also a very critical one. In many countries where health services are available to all citizens, irrespective of the cadre to which they belong in terms of the economic bracket, they have always had a very robust medical insurance scheme by which the poor have their medical bills subsidized, and the rich, especially the rich who are not sick, are contributing for the monies that are used in the medical service. Today, the National Health Program is very restrictive to only public servants. It has nothing to do with those who work in private sector. All of these are a problem. What can you do to change this situation, as we are indeed in an era of a change mantra? That is my question.
Senator Ben Murray-Bruce.
Thank you very much. First of all, he stole my question. Ben Murray-Bruce, Bielsa East. The difficulty in proceeding with this process is when we have candidates and we do not know exactly where they'll be posted. So we are guessing. I'm assuming you'll be Minister of Health. And if that is the case, and like you said, the biggest problem we have is I have friends who've been diagnosed with a particular problem. They think they're going to die. They go abroad, they do the same diagnosis, they're not going to die. There was a particular couple that were diagnosed in Ibadan, a Lebanese couple. They did 2 tests on the woman, and they said she had AIDS. She wrote her will, she had given up hope, went abroad, they got them tested, and she was not HIV. We're losing a lot of good people in our country because of wrong diagnosis. I'm not a doctor, but we all concern people. People are dying every day because of the healthcare delivery system we have in Nigeria. If you become Minister of Health, how do we solve that problem, on the one hand? 2, I looked at budgets by state governments and what they spent on health, and the value for money, what they receive, is not in proportion with what they would spend in other countries and the value they would get for a hospital or for drugs. In one particular instance, I saw a budget for something like simple as a breast pump, which was 24 cents in America. Here in this country, they gave out the contract for $24. At such high cost, it is impossible for any Nigerian to ever hope to get fair, good medical services in our country. This is a very serious issue. Our life expectancy, I understand, is 51 or 52. But a lot of us are dying before we get to 50. Apart from education, this is the most serious problem facing Nigeria today. If you become Minister of Health, what would you do to solve these problems? Thank you.
Senator Joshua Lidani.
Thank you, Mr. President. My name is Joshua Lidani, representing Gombe South. Mr. Nominee, my question relates to the issue of traditional medicine. We know that a lot of our herbalists or traditional medical practitioners do a lot of work in terms of curing ailments and healing people. But it appears the orthodox medical practitioners like you frown upon practice of traditional medicine. What is your view about traditional medicine? Do you think there is something that can be done in order to encourage the practice of traditional medicine, or to refine it in such a way that it will be more acceptable to orthodox medical practitioners like you represent? That's one. Secondly, you are just coming fresh into the administration. You've not had any experience in being a minister before or any political appointment. What is your view, or what do you think the role of a minister should be in this current dispensation? A lot of people have given all kinds of descriptions to ministers. Some have described them as errand boys, some have called them as noisy makers, some have said they are engine room. What is your view about the role of minister in the present dispensation? Thank you.
Mr. President, distinguished colleagues, I hereby move that we suspend all relevant sections of our standing order to enable us sit beyond 2 o'clock to take on the other ministers. And I also want to urge our colleagues to be conscious of the fact that we are just halfway through to take the 10 ministers so that we reduce the number of questions. I so move.
Mr. President, my colleagues, I want to second the motion that we suspend our rules so that we can sit beyond 2 o'clock, and also want to add my voice to what the leader of the Senate said, that we should take cognizance of the fact that we are yet to reach halfway in terms of questions and all that, so that we can go through the nominees for the day. I so second.
Distinguished colleagues, those in favor of the motion that of the extension of time when 2 p.m. say aye. Those against say nay. The ayes have it. Senator Gbenga Shava.
Thank you, Mr. President. I'm Senator Gbenga Ashafa, representing Lagos East Senatorial District. I want to salute the courage of Dr. Ehanire, because looking through your CV, I could see that you had so much experience abroad, particularly in Germany, and you decided to come and serve your fatherland. I don't know whether so far you've been disappointed with what you have seen on ground, but I have 2 critical areas in the health sector that I want you to look at and answer this question. If indeed you pass this test, this exercise, and you are made the minister, assuming you are the minister for health, what would you do What will your agenda be to curb this incessant health workers strike, which is like pervading the nooks and corners of all the states, and it is now the norm at the national level? The second question is, the issue of brain drain is much more seen in the health sector. If you go to Europe, the Americas, and in fact, it has gone now to the West African countries. Most of their teaching hospitals, you find Nigerians even heading some critical areas there, while we are suffering at this end. What will your programs and the proposals be to stem this, assuming you are the minister in charge of health? Thank you.